My name is Kashore Mahabir and I live in Sacramento. I started noticing this heart problem in February. I told my wife and my friends and they called the ambulance and we went to the emergency.
So at that point then our team got involved and we started evaluating him for advanced heart failure therapies. In this case, what's called a LVAD, which is called left ventricular assist device. What that basically means is that we're surgically implanted a pump into the left ventricle, which is the ventricle gets affected after heart attack, and basically to provide more long-term support to get him to the eventual goal, which is heart transplantation.
Mr. Mahabir is clearly a great example of a patient who's benefited from the left ventricular assist device. He's a patient that had a very positive attitude, and when we implanted this LVAD, he had a rocky postoperative course and was in the hospital for several weeks after the surgery.
When I first found out, it was really scary.
Well, Mr. Mahabir is one example of a very good outcome from a very complex operation supported by a very complex team.
So we know heart transplant is still the gold standard for advanced heart failure therapies. For instance, like Mr. Mahabir, we're able to provide support with the LVAD. He's able to be at home with his family, get stronger, go to cardiac rehab, and while he waits on the list.
For me, it's like it's one day at a time, it's just cope with it, Got my family, my boys are home. We'll sit down, talk about it. I just get emotional when I talk about it.
We were just very unsure of how his outcome would be. So to see him walk into the clinic with his wife is always a joy to our hearts.
We tailor the exercise date per person every single day.
And they're pretty nice. They'll come around and check, and exercises. They tell us what to do. If you want help from them, they'll help you and stuff like that. They're all very nice people.
He's done fabulous. He's really gotten stronger. We can see it in his workloads.
My role as the heart failure LVAD social worker is to make sure that our patients are coping effectively with their heart disease, with their LVAD after implantation.
The role that I have here at the Advanced Heart Failure Clinic is to address any nutritional concerns that our patients may have. Kishore is actually a great patient and he's been picking up weight and doing really well with his diet.
We're just like one family. They really work with us so closely. I love the doctors and nurses.
I'm inspired by the people I work with. This is a very team-focused environment, multidisciplinary individuals that we have the opportunity to really bring them together to provide really optimal care.
This is a great hospital too. I would recommend people to come over here.
I always talk about the journey I go with my patients, really, and I think that's another thing I kind of tell my patients. I'm going to take this journey with you when you're diagnosed and get you through it.